For the past 15 years, I've dedicated myself to working with kids, to getting them out of pain from dental issues. But it's not just to treat the issues that has been my focus. I've also wanted to get them comfortable in a dental environment. As we now start having these conversations about what our new normals are going to look like in a post-COVID-19 world and how we're going to get back into society and start working, and again, I'm concerned that my patients, their families, and other families are not going to be able to access the same quality of care that they once were able to. Hi, my name is Dr. Sara Werb, and I'm a pediatric dentist in Toronto, Canada. I became a pediatric dentist because I wanted kids to do better in the chair than I did. All my patients know that they can handle more stuff in the chair than I can. They know that my dentists hate treating me, and they know that they're better patients than I am. Whether it's through watching videos or drawing pictures, playing games, desensitization, or sometimes even sedation. My goal is to work with each patient individually to try to get them to be happy, to enjoy coming to the dental office. My favorite phone call from a parent that they're late is that they had to pull over because the kids were fighting in the back over who wanted to be first in the chair. Love when I hear that kids fight over whose turn it is to play Dr. Sara. Or when my teenage patients ask me if they can still continue to come see me and if they don't have to transfer out of my practice. This means that I'm meeting my goals. But all those goals were pre-COVID-19. Once the COVID-19 pandemic hit, in keeping with my college's guidelines, I decided to see only emergency patients. But those appointments look so much different right now. Instead of meeting a kid with a high five, wearing a funny hairband, a funky t-shirt, or funny sneakers, I greet my patients basically in a hazmat suit. Can you imagine how scary it is for a 3-year-old to see someone dressed like all those scary images on the news and not understanding what is about to happen to them? But it's not just the protective gear that I have to wear. It's also how many patients I can see in a day. Pre-COVID-19, I was able to see between 15 and 30 patients in a day. Now, in following the sterilization procedures, I'm only allowed to see 2 patients within 5 hours. These new guidelines, while necessary to keep everybody safe, means that the costs of doing dentistry are going to rise, and that's eventually going to trickle down to my patients and their families. Before the pandemic happened, I was in the middle of fertility treatments. A few weeks after the stay-at-home orders started, I had a video call similar to what I'm doing right now with my doctor, where she told me that the treatments were unsuccessful and that the clinic was closed and they're not sure when I'm going to be able to get back in there to try again. And because we're not sure when that's going to happen, I may have lost my chance at having a child. Why am I sharing this with you guys? Well, my staff, my patients and their families have always been like my family. And now more than ever, because I don't have that option anymore of starting a real family, I'm recommitting myself to my practice family. I know how hard it is for the parents that I've spoken to in the past few weeks to make difficult decisions over a video call or a phone. I know that the new normal is going to be totally different. And I want to try to work with my families to get them through it. How are we going to do that? Well, the best way to do it is to avoid the scary dental appointments. And that can start at home. Not an Instagram influencer, and I don't ever want to be one. I don't think I'd be good at it. But I do want to put together a few videos and tips of stuff you can do at home that hopefully would help you guys need those scary dental appointments. And over the next few weeks, I want to share them with you. The other thing is two of the best things that have happened in the past few weeks were parents calling or sending me a message saying that their kids were so upset that they missed their dental appointment that they wanted to FaceTime with me. Even though it lasted for only 30 seconds before they got bored. It was so nice to know that as much as I missed my patients, they also missed me too, and wanted to share their news about losing a tooth or stopping to suck their thumb. So I'm inviting you, whether it's through Facebook, Instagram, or even by picking up the phone and calling the office, to connect with me. Share with me what's going on in your life, and let's work through this together.